Well, if you're on a Medicare Advantage plan, or if you're considering one for next year, the information in this video will probably shock you, but it's information that you need to know and you're probably not getting elsewhere. Hi, my name is Christopher Westfall. I've been an insurance agent for 30 years and 26 years ago started the Senior Savings Network. And today we're going to give you information that you just might not get elsewhere, but it's about what's happening with Medicare Advantage in the United States. In today's video, we're going to cover the changes for 2025, what you need to know, Medicare Advantage PPO situation. If you're on a PPO or you wanted one, that's freedom and flexibility to go outside of a network. You may be shocked to find out that your choices for next year are very, very limited. And then rural counties. If you don't live in a big city, what's going to happen to your Medicare Advantage? A lot of that is about to be known nationwide, and the impact is going to be very significant. And then changes to some benefits are happening, but if you don't know where to look, then it'll become a shock to you and may just impact all of your healthcare for the next year. Some plans are just keeping the same name, but their benefits behind the scenes are changing drastically. And you don't want to find out once you're already locked into a plan for the next 12 months. And what do you need to do right now? This is the most critical part. I've also got a couple of video clips from a healthcare provider talking about these changes and what's going on with Medicare Advantage. You don't want to miss this video. As a matter of fact, if you know somebody that's on Medicare and they're on a Medicare Advantage plan, please send them this video or send them the recording of this video afterward, just the link that's in your browser there. It may be absolutely critical for them to see what's going on. First of all, if you're on a Medicare Advantage plan or a standalone Part D drug plan, you're going to get in the mail your annual notice of change. What does that mean? It means all the little tidbits that are going to change in your plan, they have to notify you of. Now, what some people don't realize is when you signed up for a Medicare Advantage plan, especially if you did it by yourself, you may have signed up for electronic notifications, which of course they want you to do because then they don't have to send you anything as a printed booklet in the mail. So you have to check your email for an annual notice of change from your provider, but this is where the details are. In the annual notice of change for the coming year, it'll be more dramatic and more drastic for most people without you really knowing it unless you've gotten deep into the weeds of the plan. Now, most people know with Medicare Advantage, they send you tons and tons of mail every single year, right? And they also are all over the TV with commercials and commercials and commercials. Pretty much no matter where you are, you're seeing the commercials for Medicare Advantage, or driving down the highway and you see the billboards for Medicare Advantage. But this year, something is different. What's different than this year? Well, this year, they're actually trying to shed people off of Medicare Advantage. What? Say it ain't so. No, it's for real. Check this out. This is an article from Newsweek, one of the many that we have. Some insurance companies are also leaving certain markets and ending options altogether. We're talking about potentially millions of people impacted this year, more so than any year in the past. For example, Humana said it would be exiting 13 markets nationwide, leaving around 560,000 people in need of a new plan. Meanwhile, Mutual of Omaha is ending its standalone Medicare prescription drug plan, that's the Part D plan, because of the costs associated with the Inflation Reduction Act. Now, I've been covering that in exhaustion on this channel. If you don't subscribe to the channel, you really, really need to, because you're missing out on things that could impact not just you, but all of the people who care about you and rely on you to be healthy, because you want to get health care when you need it. It says in this article, it may be needed for some seniors to take a deep dive into their annual notice of change. Where are you going to hear that? Said Alex, a financial literacy counselor, instructor at Tennessee University. From year to year, these documents may not carry much weight as it does this year. Oh, you could say that again. Changes at the federal level, changes with number of providers, and sadly, changes to premium cost in the year ahead. Now, one of the things that I'm very limited to, we have a responsibility for Medicare. As a licensed agent, we're not allowed to talk about all the things that we know until after October 1. We can't help you enroll or change or drop your Medicare Advantage plan until October 15th. October 15th through December 7th is that little window of time. So what can I tell you? What I can't even tell you what just was in the news about Humana and Mutual of Omaha. It's supposed to be very hush-hush unless it's public and I show you an article that's already in the public, because they're not bound by Medicare marketing rules. Well, here's something that's in the public. It says Humana and CVS, both companies are downsizing their Medicare Advantage plan. They are massive companies. And Humana said that its Medicare Advantage business is not doing as well as expected. And make that larger so you can possibly see it. WellCare, big impact here. They're exiting at least 6 states in 2025, including Alabama, Massachusetts, New Hampshire, New Mexico, Rhode Island, and Vermont. CVS, which is Aetna's parent company, said that many of its 2025 Medicare Advantage plans will be leaner than 2024 plans. Aetna's pulling out of certain counties, which may cause enrollment to fall. And then Cigna, scaling back its Medicare Advantage offering in 8 states in 2025. Cigna evaluates services areas annually for viability. This is a public statement. Network adequacy and provider engagement. If any gaps are identified, Cigna may reduce service areas and new plans. Why is it? Why are they doing this? Well, here's an article that may shed some light on it. I've got this linked in the description of this video after it's posted. Medicare Advantage plans propose cuts while continuing to maximize overpayments by the government. This is very interesting. It says, with Medicare annual enrollment period on the horizon starting October 15th, Medicare Advantage plans are beginning to announce some of the changes they'll be implementing for 2025. Changes include benefit and service area reductions, which insurance companies are trying to blame on anything other than their own business decisions. At the same time, United Health, the largest Medicare Advantage plan, is under increased scrutiny for, among other suspect practices, inappropriate billing practices that have inflated their already massive profits. As highlighted by the Center, that's the Center for Medicare Advocacy, this May, insurance companies offering Medicare Advantage plans are signaling that for a variety of reasons, plan benefit packages in 2025 might be reduced from this year. See the CMA alert, which I have linked in the video description. In addition to reducing benefits, that's the key, reducing benefits, some plan sponsors are announcing that they are pulling out of certain markets altogether. For example, according to Fierce Healthcare article, Centene is exiting, that's WellCare, exiting 6 states through its WellCare Medicare Advantage subsidiary next year, impacting 37,300 members in Alabama, Massachusetts, New Hampshire, New Mexico, Rhode Island, Vermont. Similarly, an article posted by Think Advisor titled Aetna may let Medicare Advantage fall by 10%. That's pretty significant. They quote executives at CVS Health, parent company to Aetna, warning securities analysts in a recent earnings call that many of its 2025 Medicare Advantage plans will be a lot leaner than the 2024 plans, and that enrollment may fall because the insurer is pulling out of certain counties. The article quotes CVS executive as predicting when Aetna tries to persuade current enrollees to sign up for the new leaner plans, those resells are going to happen at a much lower rate than what we have historically experienced. Even larger shedding of members was announced by the second largest Medicare Advantage insurer, Humana, which according to Newsweek is preparing to lose several 100,000 members next year as Medicare Advantage benefits shrink under higher prices. And let's see, Humana CEO indicated that the majority of the lost members will be from those who lose plan coverage in, here it is, unprofitable markets. Unprofitable. That's why they're doing it. If you're just wondering why they're leaving, it's because they're in an unprofitable market. And then similarly, according to Healthcare Drive, in an article called Humana expects to lose a few 100,000 Medicare Advantage members, quote, the insurer expects to lose a few 100,000 members after seriously shrinking its benefits and exiting markets for 2025 in a bid to boost profits after shrinking its benefits. That's the part I want to hone in on. For those of you who are not losing your benefits, it's the shrinking part that you have to pay critically close attention to. What are they taking away from your Medicare Advantage plan? See, in years past, and this is the truth, in years and years and years past, Medicare Advantage plans kept getting bigger and bigger and bigger, and their benefits were just exploding. Actually, through the last 2 administrations, 3, Medicare Advantage has just been going through the roof with the money given to them by your taxpayer money, by your money given to a private organization. And by the way, many insurance agents, and I hate to call out my fellow industry compatriots here, but Many insurance agents will tell you that a Medicare Advantage plan is the same thing as a Medicare supplement. It is absolutely not. See, original Medicare covers everything that's medically necessary and has almost every doctor and hospital in the country. There is no network that you have to look at. But what brokers will say is, oh, this is just like a Medicare supplement by putting you on an Advantage plan. But the better part is it's just cheaper. Listen to this provider tell it in his.
When I have patients who say, but I was told I have original Medicare, that's what they were trying to get their broker to get them on with, just with a supplement. And so what they were told was, this is just a cheaper version of Medicare. It's bullcrap. It's not a cheaper version of Medicare. It's not Medicare at all, because we're not billing Medicare. We're billing United Healthcare. We're billing Aetna. We're billing Humana. And so that is a misleading practice.
Wait till you hear what he has to say about one of the stories of somebody he's affiliated with and going through the typical Medicare Advantage process here. Despite the insurance industry hand-wringing about more people using more healthcare services, if people who need healthcare are able to access it through their Medicare Advantage plan, despite widespread and onerous prior authorization restrictions, which you only have in Medicare Advantage. You don't have restrictions like that in Medicare Supplement or Original Medicare. They reduce your utilization on purpose so they can increase the profit margin. Isn't that the desirable outcome? You're having more people get services. They're going to have healthier people. From a societal standpoint, yes, but apparently not for purposes of Medicare Advantage profit, it goes on to say. United Health and other insurance companies under scrutiny. As discussed in our recent CMA special report, again, linked in the description below, the Wall Street Journal published an investigation in July of 2024 finding, what'd they find? Medicare Advantage insurers received nearly $50 billion. That's a lot of your money in payments from 2019 to 2021 due to diagnosis that they added themselves for conditions that no doctor or hospital ever treated. Or are they real or are they not real? Did they pull them out of thin air just to upcode to make more money? You be the judge. Among other things, the article highlighted that United Health, the largest Medicare Advantage insurer, added diagnosis at a far higher rate than other major insurers. Interesting. Health insurance companies are making substantial profits from the Medicare program, including through improper manipulation of the risk-adjusted payment system. It's called cooking the books. As recently documented by the Wall Street Journal and Stat News, I've brought you both of those when they first came out. This is where you get the stuff first. Despite these overpayments and substantial profits, insurers are now complaining about their payments being cut for next year, when in fact they're over 3% increase. As a result, plans are trimming members and benefits in order to maintain desired profit margins. If you're on a Medicare Advantage plan, you are profit. You're a profit center to them. If you're on original Medicare, you're not. It's just paying for your health care. And you can go anywhere without a referral, without prior authorization. It's incredible. Plans spending considerable effort and expense trying to entice prospective enrollees through extensive marketing and promotion of extra benefits, while downplaying limited provider networks and onerous prior authorization requirements. That's true. These same plans appear to have no qualms about shedding members when they happen to live in an unprofitable market. So I hope this is not you, but if it is you, I'll tell you what to do about that here in just a minute. So as we approach the fall enrollment period, the article continues. Remember, when plans pull out of certain markets or reduce benefits, these are business decisions. Don't let them get away with arguing otherwise. It's true. So here's another thing that's going on. You've got a lot of PPO plans, and that's a preferred provider organization. They've got their own doctors that you can go to. They've got their own network in most all cases, but what they want to do is give you the option to go outside the network too. And while many people just simply don't understand, yes, I can go outside the network, but will every doctor take me on a PPO? The answer is no. The doctor has to agree to the fee schedule of your insurance company and agree that they will go ahead and bill your insurance company individually for you, even if they don't have a contract. That's a big if, but it does happen. At least if you're going to be on a Medicare Advantage plan, be on a PPO so that you have options outside of just a finite and ever shrinking now network of doctors that otherwise on an HMO you have to go to. Well, what we're seeing now for 2025 is a massive change and a lot of plans that were Medicare Advantage PPO plans, giving you this choice and this freedom, especially in rural areas where they just don't have an HMO network. An HMO network is small, it's restrictive. PPO also has a network, but you can go anywhere if it's accepted by them. But what we're seeing literally is multiple companies pulling out completely with their PPO and just leaving an HMO, if anything at all. If it's a rural area, here's what's happening. They have doctors that are in the rural area, right? And they have a limited number of doctors there, and that's the rub. See, if one doctor won't treat you, you could just go and get a contract in their HMO to a different doctor, because there's plenty of doctors to go around in a city. But no, not when you're in a rural area, and there are just not that many doctors out there at all. So the doctor's calling the shots. So these carriers are saying, well, they're going to go out of network, and the out of network utilization has been so high, and especially in these rural areas, that it's just not profitable to continue having those PPO plans. So if you're on a PPO, especially, but actually everybody should, please look very, very, very carefully at your annual notice of change. And if you get a letter saying that your plan is being terminated, stick around. I'm going to show you what you have to do there. And you have to do something. If you don't do anything at all, you'll be dumped back onto original Medicare with no Medicare supplement, which exposes you then to 20% of all the potential cost of all of your healthcare going forward. 20% with no cap. So you don't want that to happen. You have to be proactive, and you have to actually do something. So here's what to look for if you're not getting terminated. Here's what to look for in your annual notice of change. If you are being terminated, stick around. I've got that too. Oh, by the way, if you find anything helpful in any of our videos that we put out, and we research exhaustively about what's going on with Medicare, please give us a thumbs up, like the video, and please share it with anybody that you know that's on Medicare. Appreciate that very much. Here's what to look for. Many of the plans were low premium Medicare Advantage plans. Yes, some of them actually have a premium of $20 or so, and those are going up significantly. A lot of them are. Even some free plans are going up to not free anymore. And if you don't do anything about it, you'll roll into the new version of the plan. It may even have the same name, but the benefits underlying that plan are significantly changing. That's one of the differences between Medicare Advantage and Medicare Supplement. Medicare Supplement just sits on top of original Medicare with all the freedoms we talked about. Any doctor, any hospital in the country that accepts Medicare, which is most all of them. That's a supplement. There's no brain in a Medicare Supplement. I hate to degrade anybody that's in that industry, but a Medicare Supplement literally has no claims paying brain about it. If original Medicare says, yes, that's medically necessary, this supplement automatically pays that claim. Automatically. On a Medicare Advantage plan, that's not the case. They have a medical director. They have prior authorization permissions required. You'll see the story from the provider here in just a second, talking about one of the nightmares that he experienced. But anyway, what they're trying to do is keep as many of the zero premium Medicare Advantage plans as free on the front end and raise it on the back end, because they know if you have a free, what they call, plan with no monthly premium, you're likely to stick around, especially the folks that are the vast majority that don't even look at their annual notice of change. They don't notice the other stuff down underneath. Your hospital stay costs. We're seeing some companies, without giving specifics because we don't want to do that, some companies are literally changing the number of days on the Medicare Advantage plan that you have to pay a copay. So if their copay was $250 a day for 3 days, that was last year. Oh, no, this year, because they change every single year, you could see up to 12 days of a Medicare Advantage copay for every day in the hospital. Suddenly, that zero premium plan is not so hot anymore when you actually go to actually use it. By the way, let me just little caveat here, just so you know in context. Medicare supplement plans, the ones that I talked about with the freedom and flexibility to go anywhere, yes, they go up in annual in premium. The costs do go up on those typically, but they never change. A plan G will never change from a plan G. A plan N will never change from a plan N. And neither one of them will ever have a network of doctors that you have to worry about. So that's just the contrast between original Medicare and a supplement where nothing changes, and these suckers where you have to check on it every single year and see what did they slip in now. So hospital stay costs, drug tiers and formularies are changing drastically. Why? Because as we covered in our last video, the Inflation Reduction Act drastically change the drug plan. Yes, it'll benefit a lot of people by having a $2,000 cap on the drug cost for you, the senior. That's fantastic. Where are they going to make that up? They're changing things around. They're reshuffling the deck. And like a balloon, if you squeeze one end, guess what? It's going to pop out on the other. Same thing's happening with your cost. But in Medicare Advantage plans, a Medicare Advantage is what we call in the industry an MAPD plan. Typically, it's a Medicare Advantage and Part D rolled into one. They'll typically call it the all-in-one or the complete or something that sounds fantastic until you realize that one area that's squeezed by the government, and in this case by the Inflation Reduction Act, always affects the other part. And with a finite number of dollars, what are they going to do? They're going to reduce the other benefits. So look at the drug tiers. What you had before as a tier 1 drug, very, very cheap, very inexpensive drug, may have actually moved to a tier 2 or tier 3. As a matter of fact, the deductible that many times was not changed or not charged at all on lower tiers with many plans, now they're going to charge the deductible first. And for 2025, it can be as high as $590 for the deductible just before you get any drugs at all and paid for. And then they're removing some of the goodies for next year. The flex benefits cards, some of the gym memberships are changing drastically. And the dental benefit is one of the most significant changes we're seeing, where major services were covered by only a few of the dental plans in Medicare Advantage. That's always been a big rub for me. Medicare Advantage will say, yeah, but original Medicare does not have dental. Well, guess what? We have dental plans available all across the country. They're very low premium, but they're real, comprehensive dental plans. They even cover you if you go in a network or go out of the network. Those are real dental plans. The dental that comes with Medicare Advantage is not, for most parts, for most all companies, it's not real dental. It's to say that they have dental, check off a box and say, yeah, you get 2 free cleanings a year, but don't come to us for major services because those are not really covered. This is not a real dental plan. It's kind of like a little bitty throw on. It's an add-on dental plan. If you want real dental coverage, yes, we have access to those. And it can go with a Medicare Advantage plan, or it can go with a Medicare supplement plan, real dental. These dental plans are a changing. Many of them and many, many plans across the country went from bad dental plan to a worse dental plan, covering way less than they did even before. And then we're seeing unbundling of procedures. What does that mean? If you're going to have a knee replacement surgery, it's going to encapsulate a whole bunch of things: doctor visits, lab work, rehab, physical therapy, follow-up visits, and all that. Well, now we're seeing some plans that are going to say, look, yeah, we're going to charge you now for all those things instead of one big thing. That includes doctor copays, outpatient surgeries. We're going to have a copay for those things. We're going to have copay for all those things are going to be unbundled and charged to you. Bam, 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 another copay, 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 copay. So on the Medicare Advantage changes, you've got a choice you've got to make, either to change to a different plan. It might have something better, and I'll show you how to do that, who to reach out to for that, or drop it all together and go back to original Medicare. Whatever you decide during that period of time from October 15th through December 7th, then we have a little period of time where everybody takes off for Christmas and we can actually breathe for a couple of weeks. And then all those plans that you chose during that period of time kick in on January 1st. Now, you could make a decision at 11:59 p.m. on December 7th, which is my birthday, and Pearl Harbor Day, which is still a day which will live in infamy. That's my birthday, the end of the season. And whatever you chose then, even if you chose it the very last second, doesn't matter, that'll go into effect on January 1st. So many people will try to call our office, literally tens of thousands of people will try to call our office and get in here on the calendar for us to help them on October 15th. It's not really necessary because there's no advantage to you of having an application done October 15th as it is October 20th or 21st or 22nd. But at the same time, thousands of people try to call us December 1st, 2nd, 3rd, 4th, 5th, 6th, and 7th, and then everybody piles on and they're mad at us every single year. And they've done this for 20 years. Every single year mad at us because we don't have the capacity to handle all the procrastinators that waited until the last minute. So we're booking appointments for this season already and have been for months now. So you can either switch Advantage plans from one company's Medicare Advantage plan or to another company. You can go back to original Medicare, but if you go back to original Medicare, don't just leave it undone. Because if you just leave it with original Medicare, you are subject to 20% of all the outpatient costs, and then copays for things like Part A. That's when you go into the hospital. there are a lot of costs associated with original Medicare. It's a great program. It's just not a total program. And that's why the supplement literally sits on top of original Medicare. Now, in some cases, you can get a Medicare supplement later in life with no medical underwriting whatsoever. No questions asked. Nobody's going to stand in your way. Certain states are like that, like New York, for instance. But in most states, they have to ask you health questions. But one of the examples of where they don't is if you get a notice of a plan termination. If you get the notice your plan is no longer going to be in the market, and if you do nothing, you're going to be dropped back on original Medicare, that letter you get, that plan termination letter, instead of a notice of change, because there is no notice of change when your plan's just going to be gone, and lots of people on HMOs and PPOs are getting those notices this year. You have to pick another Medicare Advantage plan, or if you do go back to original Medicare, it's going to be guarantee issue to get you a Medicare supplement plan. And that's terrific because they know that you're between a rock and a hard place. And yeah, you could go back to another Medicare Advantage plan and every year complete the cycle again where what's changed now? And again, as we're on the slope of things getting worse with Medicare Advantage instead of getting better with Medicare Advantage, there may be lesser and lesser and lesser benefits available to you. And this is one time get out of jail free card. It's that golden ticket if you're holding the notice of your plan termination, no longer going to be in your service area. By the way, little caveat that only comes from experience that you should know. If you leave the plan's coverage area, if you get, hypothetically speaking, if you get cancer, you get some horrible, dreaded disease that's going to be a long, long process. And you know, by looking at your annual notice of change from the year prior, or you're looking at your summary of benefits from your Medicare Advantage plan, you know it's going to cost all of your max out of pocket, and you're going to have fights with the insurance company on prior authorization and getting anything covered whatsoever. Wait for this provider to tell you one of those very significant and very all too common stories. Then you can go and leave the area, maybe move in with a relative. And if that relative happens to be outside of your county, outside of your service area for your Medicare Advantage plan, it's the same thing as this. It's called a special enrollment period. You or the health plan have moved outside the service area. So you get this golden ticket letter that says your plan's being terminated because you don't no longer live in ABC County. You've moved out of the service area. So you can take this letter and go to any Medicare supplement company then and have everything taken care of with no prior authorization, no pre-existing condition limitations. They can't tell you no. You pick the best oncologist. You pick the best facility, no matter where it is, and you can go. Cancer Treatment Centers of America, MD Anderson, Johns Hopkins, all of those that are not typically in a Medicare Advantage network, if at all, in any Medicare Advantage plan. You just go. And how you trigger that is by moving outside the service area, notifying Medicare, notify your insurance company. I've moved outside the service area. I've moved to this address. They'll pick up on it and say, nope, you're out of our network. So you have to go get another plan. And that notice of termination works the same if it's the insurance company doing it or if it's you doing it. Before I show you this, how to contact us, it's a little clip from one of my first public speaking engagements when I was in my 20s as a sergeant with the sheriff's office. Let me share with you what this provider had to say about Medicare Advantage and the changes that's going on with it right now.
Her name is Dolores. She had a femoral fracture, it's just a thigh bone fracture. And she needed surgery, and she was 6 weeks of non-weight bearing because of the extent of the injury. The algorithm, by the way, a lot of these Medicare Advantage plans are not using frontline, or I shouldn't say frontline clinicians. They're not using clinicians to actually make the determination of how much care you're supposed to have. They're using an AI first. So the algorithm says she only needs a skilled nursing facility for 15 days. But the problem is she's non-weight bearing. She couldn't transfer herself. There's no way she'd go back to being home on her own because she needed a Hoyer. And they denied her care even under appeal. So she had to private pay for the next $40,000 to get her through the next couple months of skilled nursing facility care. And then interestingly enough, her friend who actually sells her MA plan, when she explained to them what the issue they were having with these things, they actually ended their relationship because she was so frustrated with the Medicare Advantage plan. And then sure enough, he had a knee replacement a couple of years later and said, I'm so sorry, I didn't realize what I was selling. So kind of a wild story.
Didn't realize what they were selling. Medicare Advantage agents, and this is going to make so many people mad. When we sell a Medicare Advantage plan for somebody making their first decision on to what to do with Medicare when they're turning 65, they're 64 years old and they're wondering, what do I do to make a Medicare decision? You'll be fascinated to know, if you don't already, that 90% of the marketing coming at you is all to get you into a Medicare Advantage plan. I wonder why. We, as licensed insurance agents, make a ton more money by putting you, brand new to Medicare, on a Medicare Advantage plan and simply telling you this is as good as Medicare, but it's better because there's all these perks and benefits and all this added stuff that has nothing to do with your health. But we're going to give you all these giveaways because these companies are so flush with cash that the taxpayers are giving to them. The insurance company lobby, less and less this year. But we as agents make a lot more money if we put you on a Medicare Advantage plan. And the road less traveled is the one that far too few people are saying publicly, and that is, you paid into Medicare your whole entire life. You have the right to stay on original Medicare, the one that you've earned. You've got the right to stay on original Medicare, and during certain enrollment periods, like when you're new to Medicare, or you're leaving an employer plan after staying on an employer plan way past 65, you never activated your Part B of Medicare yet. Well, when you activate your Part B of Medicare, because you can defer that as long as you're working for an employer group that has 20 or more employees, you can wait on Medicare and just take the group benefits if you want to. And one of the things that we do that's a tremendous value is we always compare for folks, what is your employer plan giving you now? And what would Medicare that you've been paying into all your life and you're finally eligible for, how much would that cost you? With no network limitations, in some cases with no copays whatsoever, no cost to go into a hospital, no network restrictions of which hospital you can then go to. And many are really dumbfounded to figure out that I've been working for this major company my entire life, 20 plus years. And you mean to tell me that Medicare and a Medicare supplement is better than what I have at work, even though my employer is giving me a benefit? Yeah, you'd be shocked to find out, not only from the freedom side of being able to go anywhere you want to in the country now, but also on the cost side, because it's heavily subsidized by taxpayers still, even the Part B cost that you pay every month to be on Medicare. But the first time you activate Part B, now you've got a 6-month window from that point forward that you can join a Medicare supplement plan anywhere in the country with no questions asked. For all other types of the year, people often don't know you can still get a Medicare supplement plan in most states by just going through some simple underwriting questions. So a lot of people are asking this question. I'm on a Medicare Advantage plan. I want to get off of it. How do I get off of my Medicare Advantage plan? There are 2 times of the year you can do this, unless you move out of the service area, and that triggers a special election period. But during this period of time, from October 15th through December 7th, you can get off of your Medicare Advantage plan for January. We can help you through the steps on doing that. It's also covered on our website, which is listed right there. Look at our website under Medicare Help and the part that says Medicare Advantage to Medicare Supplement. How do I do that? It goes through it step by step, precept upon precept, and you don't want to go out of order with that. So it's a simple process, and we go through the underwriting with you. We can help you with the underwriting. Matter of fact, I've got a website that explains how the underwriting works. So if you want to say, will I qualify? Well, why don't you go to this website, seniorsavingsnetwork.org/underwritten, and see if we can get you underwritten so we don't waste your time. We'll talk about many of the chronic conditions that are a no, how the health questions work. And yes, they are slightly different from company to company, but that's where it's beneficial for you to go to an independent broker. See, we don't work for an insurance company, any one insurance company. We don't have dinners where we invite you and serve you food or try to lecture you. No, we just provide value by knowing what's in the marketplace, who has the plans that might best fit your specific needs by first listening to what your goals are, what your experience is with health plans, and what your risk tolerance is. How much risk do you want to avoid? You want the best possible Medicare supplement plan that allows you to go anywhere in the country and pays for all of your bills for you? We have that. And how do you get there? We have one that has copays, so your costs are low And more importantly, your annual renewals, when your premiums go up, are much smaller because you absorb some of that risk. You absorb some of that by paying the copay. So we can go through all those options for you. And here's the thing, really important for those of you on a Medicare supplement. It's critical that you hear this and you hear this now. If you're on a Plan G or a Plan N or even a Plan F, we can help you with a Medicare supplement to shop the market, because the only difference in those benefits are the premium, because they're standardized plans. So hear me very carefully, please. We're going to have thousands and thousands of people that are getting shut out of their Medicare Advantage plan. And they're going to be in a tremendously sad and scary situation. They don't know what to do. They don't know where to turn. We're trying to keep our calendar as free as possible to help those people who have no other choice. They, for whatever reason, either can't afford a Medicare supplement or they can't qualify for one. So we have to get them the best suited Medicare Advantage plan for their needs. And we have a very small window to do so. So if you're on a Medicare supplement plan already and it's working for you, and maybe even if your renewal is coming up and you're saying, I'm getting a notice from the insurance company, it's going up $4 a month, it's going up $8 a month, please, please, please try to get on our calendar so we can help you shop the market, look at what's available, see if you'll qualify. All those things do take time, and we're happy to do it with you. But since you can literally change your Medicare supplement plan, otherwise known as Medigap, 365 days a year, if you'll just give some breathing room to these poor folks that are on Medicare Advantage that don't have a choice and need an advocate for them to put them on a better plan or one plan at all if they're losing theirs, we have until December 7th just to help those people. So anytime other than that, let us help you change and shop and find and qualify for a different Medicare supplement plan. But right now, until December 7th, we have to really comport all of our time to help the literally hundreds of thousands of people across the country that are trapped on a Medicare Advantage plan or just got the notice and just found out that their plan is changing drastically for next year, or for whatever reason, they want to look at either a different Medicare Advantage plan or go back to a Medicare supplement for the freedoms that we've been describing here, as far said too few times on YouTube. So if we can help you, here's our phone number. It's 800-729-9590. You can actually book an appointment on our website by going to the website, going to Medicare Help, putting in what your condition is, and then you can book an appointment. You can do it at 3 o'clock in the morning. You can do it at 1 a.m. Whenever you're finding this, whenever you're looking at this information, you'll skip ahead of the line from where we're able to call you back and then look at our calendars together. If you just go to the website and book your own appointment, it's far more convenient for you because you don't have to call us and then wait for a call back. During this time of the year, calling people back is a very, very challenging thing. I know a lot of insurance agents that they're just getting started. They're desperately prospecting. They're calling people. They're dropping direct mail. They're even knocking on doors, which is highly illegal, but they're doing everything in their power to prospect. Here we have the exact opposite problem. We're trying to prioritize. We're trying to triage. We're trying to help as many people that call in as possible. And it'll be thousands and thousands of people that we may not be able to get to. So I encourage you to book a time, even if it's late October, November, if it's December, whenever it is. Anything that you do with regard to Medicare Advantage that happens up until December 7th at midnight is treated just the same as if you signed up on October 15th. Now, talk quickly about drugs. The drug plans, they're a changing too. We talked about that in the last video. You can go to this website below, startpartd.com, and you can compare the drug plans with the companies that we have chosen to do business with. Now, many of these companies, in fact, most, have cut out the broker 100%. Going forward. So you may not see every insurance company listed there. And if they have horrible customer service and we've chosen not to do business with them, you won't see them there on this website either. StartPartD.com is as easy, if not easier, than using Medicare.gov, which is the other place that you can go to get a Part D drug plan. You have to do that by December 7th to look at your drug plans. They're changing drastically, but like I covered last time, this demonstration project that the Biden administration came up with at the last second to save Part D from the effects of the Inflation Reduction Act, which was going to be devastating for it. This demonstration thing, which is a temporary program to prop up Part D, It's been said that now the give to the insurance companies is $159 per month to subsidize your Part D premium for those companies that chose to participate in the program. They all did for the next year. So you won't see as much variation as we were expecting before they just came out with this demonstration, but there are significant changes, and it is definitely worth your time to go to startpartd.com. It's very simple. You put in your drugs, you put in your pharmacy, and it'll automatically show you the best possible lineup plan for you. You can choose which plan you want. You can sign up 24 hours a day, again, during the period of time from October 15th through December 7th. Or if you're new to Medicare at any time, you've got the 3-month window before your birth month, and 3 months after that you can sign up for a Part D drug plan. And you can do that on that website. It's very simple. But if you want to look at all the plans, even plans that we don't represent, you can do it, but you'll do it at Medicare.gov. Please be aware, if you call Medicare.gov and you say to them, I'm on a Medicare Advantage plan and I want to go back to original Medicare, they'll let you do that. But they don't know Shinola, that's a technical term. They don't know anything about Medicare supplement plans over at the Medicare. Medicare.gov. You might be shocked to learn this, but they can't sign you up for a Medicare supplement plan. They can't tell you the details of how claims are paid or how things are done on a Medicare supplement plan. They can't put you in a Plan G. They can't put you in a Plan N. Medicare.gov is not the place to go for a Medicare supplement plan. Going through an independent broker that is unbiased and will show everything to you and put you in the best plan, that's the best way to go if you want a Medicare supplement plan. Or, because here's the thing, if you call into Medicare.gov, there's a very, very, very high chance, even if you're calling them about your Part D drug plan, there's a very, very high chance that they may say, you know, you're paying a lot for that Part D plan. Why don't you just let us give you a complete plan? What's that? Oh, it's a complete plan. It's as good as Medicare, but it's even better because we've got a couple of perks left on the table. You get free dental insurance. I just wouldn't fall for that. That's called the upsell. And for some reason, all the insurance companies do it. If you sign up with a Part D plan with XYZ insurance company, expect a call. Even if you sign up on your own, online, expect a call. They're going to say, hey, I see you signed up for this Part D drug plan, but what are you doing for your Medicare supplement? Well, you know, we have this plan. It's a Medicare alternative plan, but it's just as good as Medicare, which is not, because there's prior authorization. They're denying claims. You have to do appeals to get things covered, et cetera, et cetera, et cetera. But if you just sign up with me over the phone, I've got all your information. I can just flip you over right now. Please don't fall for that. But if you did, there's a second period that I didn't get to. And that's the Medicare Advantage open enrollment period, which is very misleading. We call it the disenrollment period to be more accurate. And that starts in January and runs through the end of March. But we'll talk about that when we get there. That's for people who've made a mistake, got on the wrong Medicare Advantage plan, wanted to go back to original Medicare, but couldn't get through to anybody on the phone, which we're anticipating. So let us help you. Call early, call often. We can get you on the list, and we can help you if you're on our calendar for the crazy busy Medicare season. It will be nuts. Please make sure you're subscribed to this YouTube channel and let other people know that it exists, especially if they're on Medicare, because the life you save literally may be your own or theirs, just by giving them the education that they can get things covered and they don't have to get denied. It's not a part of Medicare to have to be denied for the purpose of somebody making more money off of you. It's a choice, and one choice that you don't have to make. And yes, Medicare Advantage is a necessary evil. If you can't afford a Medicare supplement plan, we know there are people that can't afford a Medicare supplement plan. That's why we want to be their strongest advocate and put them in a Medicare Advantage plan that we know the customer service is good and they're going to get treated okay, and we can advocate for them. That's why you should use an independent broker. God bless you. Thank you so much for watching. Bye-bye.